Good morning. My apologies. This is the week 4 walkthrough. So we are in the middle of week 4 as it is Wednesday, July 3rd. Happy 4th of July to everybody tomorrow. Hopefully you can take a day off and celebrate our country. I wanted to walk you through the week 4 module in case you have any questions. I know that some students in South County have been experiencing some Wi-Fi issues, so I had put out an announcement. So when you come to the home page, remember that there will be announcements, the most recent announcements listed there. So please remember to check in there because there could be vital information that's important to you that might help you there. So this was the assignment updates for weeks 3 and 4. Nothing will be counted as late. Just get it in. Try and catch up as best you can. Please reach out to me if you're still having issues so that we can work on a plan to get you through the course. And what else? The other thing is the therapeutic communication assignment that students have been asking questions about. That due date was moved out a week, so it's actually due this Sunday, not last Sunday. And so basically you are going to practice therapeutic communication with each other. You do not have to video or record your Zoom and turn that in. You're just working through the scenarios in your small group and then turning in the reflection. And so people keep asking, where are the groups? And so let me actually go to the student view so we can see it like you see it. So this is the announcement. So I'm in announcements. And so the groups are listed here. 1, 2, 3, 4, 5, 6, 7, 8, 9. And what else do I want to tell you? For group 2, it's just Jessica and Jasmine. Noe has dropped the course. I've sent a message out to y'all, and it gives you the scenarios that you're going to practice. You do the assigned one, and then you can choose any one of those that you want to work through that again. And so those are the groups. Now, some people are saying that they're having trouble getting a hold of each other. So I'm not quite sure why. Everybody is invested in the course and I'm willing to help people connect if needed. That's why we have the Google Chat so that you can reach out to people there. You can make your own chat. You also, if you look on the left-hand side of the screen here, if you go to the People tab and click on People, it will give you the names of the students that are registered in the class, as well as myself. And then if you click on groups, I believe your tab says therapeutic communication groups. I don't have that because I'm not in one of those groups. But if you clicked on that tab, it would bring you to your specific group. You would not necessarily have a whole list of the groups. You would just have the one. So for example, Yvette's group is therapeutic communication 1. That's how you know which scenario you have. And so you can click on that. That will tell you who's in your group. You can also, then you have like your own little landing homepage for that. If you click visit, you actually have the capability to post announcements. If you go to people, it will tell you who's in there. You can send announcements. You can do discussions. Make all your own, it's like your own little class in there. And then to get back, if you click on the NRN NBN 70, it will take you back to the home page. And so that's where these assignments are. So let's jump into week 4. Which you are in the middle of and working on some of the things from week 3. Week 2 should be complete. You should have completed everything at this point from weeks 1 and 2. with only a few things outstanding from week 3, because we have to keep moving forward in the course. And what I'm excited about week 4 is that we actually now, after having gone through all the fundamental things that we need to learn about therapeutic communication, the developmental theories, we are now going to start to go into the actual stages. So we start out with genetic influences and prenatal development and care. And then for week 5, we go through the birth process, postpartum period, and then infancy. And then we start on early middle childhood, adolescence, and then on into the adult stages. So I'm hoping that we have developed an understanding of the stages a little bit, keep going back to those, write little cheat sheets for them, and we'll go on from there. So I am curious if students are liking the new format that I posted. I'm trying to make my pages less busy. I've gotten feedback from students about that in other classes that I teach. And so hopefully this is working for you with the links. So these are, this would be a link to the actual module page, which you can also access in your left menu. So it takes you to week 4, where there's the overview. You have a lesson 4.1 on genetics and heredity. You have a lesson 4.2 on prenatal development. And then this is what you need to turn in. I started to number them accordingly. So 4.1A goes with this lesson, and the 4.2 A goes with this lesson, the 4.2. So hopefully that that works well for you. You have your journal from week 3 that would be due. And then you also in week 4 will have your quiz. And here are the focus areas for the quiz. And then there's also an ungraded course feedback survey, which I will go into a little bit later. So let's go back to the home page. Here's our assignments. So the objectives are to compare and contrast genetic factors versus environmental factors on growth and development of an individual. We've talked about social determinants of health. We've looked at Healthy People 2030. We've looked at governmental influences. And so now we're actually, those are more environmental influences. And so now we're going to focus a little bit on genetic factors that can affect growth and development. And then how those traits get passed on, and then how healthcare professionals can promote optimal physical and social emotional development across the lifespan, which is including prenatal development and care. So genetics and the prenatal development kind of go together. So if you click on genetic influences, this tab right here, it will take you to what you need to know for that particular lesson. And so the goals, the objectives for the genetic influences on growth and development, how genetic traits are transmitted, how a selected chromosomal disorder will affect growth and development of the individual as well as their family, because we now also know about family systems theory. That's something that affects one person, affects everybody. And then being able to identify examples of environmental influences on growth and development. And I do believe that through your community windshield survey that you were able to look at some of those influences. So here is your reading. It will take you to these particular pages in the book, and then you need to look at the these delineated lessons. And then let's go to one. So if we go to the Lumen Prenatal Development, and then we were supposed to look at 3.4, 5, and 6. So 3.4, 3.5, 3.6, right? Those are the ones that that have to do with the genetics. So that would be your reading there. And then you have your lesson page, which we'll go to in a minute. You have your activity assignment, and then you have your reflection. These are the questions for your journal, what needs to go into your week 4 journal. So in your opinion, having studied these things, which affects growth and development more, nature or nurture, the environment, nature or nurture, or heredity? What evidence do you have to support your ideas? And then what was the most interesting thing you learned when completing the genetics assignment for the lesson? You can use more than one example if you would like. So those would be your journal questions, and those have been added on to that week 4 journal assignment. And then your activity assignment, which actually some of you have already completed because I unfortunately put the wrong due date, and I apologize profusely for that and for causing a panic. I don't like to do that, but I am human. So thank you to Diana for pointing that out to me. And so our learning outcomes, how are genetic traits transmitted? We're looking at chromosomal disorders. And so what you're going to do is choose from this list, and there are supplemental materials for you to look at, to look at some of these different ones and see which one you might like. These are passed on genetically, and or some of them, like spina bifida, gastroschisis, some of those are or Pierre Robin sequence, I guess, as well. Sometimes they're genetic and sometimes they're not. That's what studies are saying. So that's why they are on the list. And so what you want to do for the assignment is to write out a description of disorder as you would explain it to the parent. So a lot of people so far have been kind of scientific in their explanations. And so what you need to do is take that scientific explanation and then pretend you're explaining it to one of your family members, maybe. And so a basic level and how that particular gene gets, how the disorder is transmitted. So if it's a dominant autosomal recessive, it's a recessive. You have your Punnett square, and you have 25% and 25%. We'll go into that in the lesson in a minute. And so then explain 2 ways that the growth and development of the child might be affected. And it could be across the lifespan. So if it's something perhaps like trisomy 21, that's not something you can fix. So there are going to be lifelong growth and development sequelae as a result. And then 2 ways the family can potentially be affected. And then what do you feel that you could do as a healthcare professional to help the client and their family meet their needs? And so it's supposed to be kind of fun to do the research. There's really no minimum or maximum to write, as long as you cover all those points, the 2, 3, 4, and 5. And then you do need, because some students are forgetting, you do need to provide at least one reference related to the disorder that you've chosen. So I know the source of your information, and you don't have to do any particular format. And then if you have questions, let me know. And so then these are your supplemental materials. So there is NORD and the Genetic and Rare Diseases Information Center. These are websites that talk about, oops, nope, don't want to go there, that talk specifically about rare diseases, rare disorders. And so they have this one, NORD, for example, has a lot of resources for families, for people. And then they also, what a cutie. And then, about living with a rare disease, they have different news and events that are coming up. And then if you, they have the database. And so if you search now, 1,200 rare diseases in their database. And so they're alphabetical, you could type it in, those types of things. So the database has grown. I actually used it when my son, who was born with gastroschisis 33 years ago, they were just kind of getting the database started. But it was very helpful because they also connected you with people. We used to have discussion boards, blogs, I guess, if you will, in the early days, where we could go and talk to each other and support each other, which was really cool. And then the Genetic and Rare Diseases Information Center, browse by disease, you can type it in, or they're alphabetical. It specifically pulls up, which I'm not asking you to know about, but these are specific genetic things, microduplication syndrome. So genes have been duplicated, and these are different specific genes. So just to know that, oh my goodness, there's like so many out there. It's just unbelievable. And then the hereditary disorders, so cystic fibrosis, galactosemia, Klinefelter's. It's our little guy, osteogenesis imperfecta, our little Shriner's guy. And then Rett syndrome. This is actually a client who actually has Rett syndrome, and she kind of runs a little mini support group for kids. She's a child. And so this is her little card there. Stargardt's disease, which is genetic, and trisomy 21. A lot of you are choosing trisomy 21. I know somebody chose Klinefelter's and did a nice job with that. Several people have chosen cystic fibrosis. So, whatever interests you or you want to find out more about. And then these are sometimes hereditary, the Pierre-Robin syndrome, also known as Pierre-Robin sequence, and then congenital defects, spina bifida, and gastroschisis, which they are finding may or may not have a genetic component at some time. And so if you click on the picture, for example, it should, yes, take you to some resource that will talk about that particular disorder. You can use that resource. You can do your own research, whatever works for you. And then please, 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 I'm finding that a lot of students are not following the rubrics. And so that's why you are losing points. Each assignment has a rubric, and it's generally put together most of the time in the order that the paper, the write-up, the presentation, whatever, should flow. So for example, did you choose a disorder? Yes, I chose trisomy 21. Did you describe it? Yes. At the level that a parent could understand. And then effects on the child's development, effects on the family, and help for the client. Those are all things that came from the original description up here for that assignment. So to earn the full points, you follow the rubric, make sure you have all those things, provides one reference is in there, and then you can earn your 10 points. So let's go back to the week 4 module. So we did the overview, we did the assignments. That was the genetics influences on growth and development. We were actually on, let's go back to the overview. So we're at the place where we started, right? So we did the reading, showed you the activity. You've got your journal questions. Now let's go to the lesson for genetics. So this week's lesson is going to talk about genetics and the nature versus nurture debate, and talk about how different traits are passed along. So here are your objectives again. Here's the reading again for you, and there is your activity or assignment that is due. And then we move into the lesson. So you do have a genetics and prenatal PowerPoint. It is from several years ago, but the information is still relevant. Gotta have my coffee in the morning, sorry. And then, oops. And then a little video that talks about how how traits are inherited and patterns of inheritance. So let's look and see. So this is an article that talks about classic Mendelian genetics and patterns of inheritance. So it talks about autosomal dominant, recessive. A lot of things are autosomal recessive. There's things that are X-linked, the X chromosome, so the female carries it. Some things could be in the mitochondria part of the cell. And so then these are examples. So autosomal dominant, like Huntington's, achondroplasia would be dwarfism, autosomal recessive, so cystic fibrosis, phenylketonuria, Stargardt, X-linked dominant and recessive, so vitamin D resistant rickets, hemophilia, Duchenne's muscular dystrophies, and X-linked recessive. So I just thought that was a nice little quick explanation of what that is. And then this particular video at 6 minutes. Whoa, that was loud. So sorry. And I think it's really nice because it talks about the chromosomes and how they split, and when you make a baby, how the genetics and the genes and the chromosomes are all transmitted. and then different examples of genetic diseases. And then here you have different articles on nature versus nurture. And so again, this will take you, I like Very Well Mind. I think they're a good resource. And so this one talks about nature versus nurture. So is it really nature, what you're born with, or is it how you're nurtured, your environment? And that's why we talk about the social determinants of health, because that has to do with your environmental influences. And so it just goes into, genetics, the way we're raised, the debate. And there are many studies that show, for example, twin studies that show that twins, so identical twins, I should point out, identical twins, so the exact same genetic material, but raised in two different environments and have two different personalities, two different ways of life. So that might lead you to think that the environment is more important. I don't know, maybe, and sometimes it is, and maybe sometimes it's not. And then this will take you back to some theories of child development. So I just think it's a really good article that just gives you a nice basic understanding of the nature versus nurture debate. And then effects of heredity and environment on our personality. Oh, whoops. I'll have to go back and fix that. I thought that was in there. I guess it's not. So I will go back and fix that. Back to genetic influences, go back to the lesson. I thought I checked all the links. My apologies. So I will go back and fix it. And then heredity, environment. So this was originally a quiz, but now it also, well, I mean, it is the quiz, but it will, it tells you if it's actually the key, right? And so we know that the color of hair, your eyes, your skin, the H is hereditary. So that's a genetic. And then E is if the factor is influenced by the environment. So like relationships with family, relationships with friends, education, there's access to education, social determinant of health. And then B, if it's a factor that could be influenced by both environment and heredity. And so, for example, physical strength, you can have the genes for great muscles, and then you work out in the environment. And so then that increases your physical strength. And so, so that I thought was really kind of interesting. And then it gives you a little mini case study there to kind of look at. So I thought that might be helpful. And this talks about twin studies. We have another article. Oh, it was there earlier. I will fix that as well. My apologies. And then this is a good slide player PowerPoint that talks about heredity versus environment. And then talking about epigenetics, things that, oops. Sorry, that is so loud. Let me just drop that down. There we go. Right, and so talking about instead of the sequence, the order, there's things that are added on to those proteins that can change it. So just a little extra something to understand that we really don't know. There's just so much going on. There was a study from 1990 to 2003 called the Human Genome Project, which actually sought to catalog the sequencing of the human genome to know what each gene is, what each chromosome does, how it's sequenced, and then from there to be able to tell those mutations that might come out. And then there's some Khan Academy videos and some mutations that actually will talk to you about like if one thing's more, how does it become dominant? How does like brown hair would be dominant? because it'll talk to you about alleles and all that kind of thing. So it's just more, we're focusing on the nature versus nurture aspect. I don't expect you to necessarily fill out a Punnett square. Just basically know that there are things like it's 25%. If I have the dominant and recessive alleles, then 25%. I can't even do that. I should probably do the whiteboard. Sorry, but you can see it's very difficult for me to explain in words. Sorry, but you have a 25% chance of getting the mutation, the genetic defect. So that was that, and then there's your reflection, which we went over already. So basically, the nature versus nurture, and then understanding how the genetics are transmitted. Those would be your objectives. And then let's go back to the module. And then now we're going to move into the influences of prenatal development and care. And so different periods during the growth of the fetus, changes that the mother experiences during pregnancy. And if we can understand what the expected process is supposed to be, then hopefully we can figure out when there's a deviation from that. And when there might be delays, we can even plan for when the baby is going to be born, anticipatory guidance. So risks to prenatal development by teratogens, which are poisons, minor and major complications of pregnancy, and 3 factors that can promote a healthy pregnancy. So again, you have your reading, those particular sections, you have your activity assignment, which I'll go over in a second. And then the PowerPoint, again from 2020, but it's the same PowerPoint from genetics because it's all together in that PowerPoint, and has key points in it. And then we talk about teratogens, examples, things like alcohol that can affect the central nervous system if the mother gets chickenpox, which is why vaccines, immunizations are so important. Caffeine, actually, limit intake to 200 milligrams per day. And BPA, we have seen in the plastics, the BPA. So we see now that things are BPA free. And they're saying that is in the last trimester, the 3rd trimester, where those effects are seen the most. And then so teratogen, something that can cause a birth defect, and usually through the environment. And so teratogens can include some medications, tobacco, chemicals, alcohol, some infections, some health problems, and then non-teratogenic agents, things that are not harmful, would be prenatal vitamins, acetaminophen, spermicides if you were having intercourse. And then this talks about timeline of effects when the teratogens can begin to affect the fetus, and sort of gives you a timeline of the most dangerous, or the time that the fetus is most susceptible to teratogens. So you can see that is in the 1st trimester. And then we move on. So we're trying to cover the objectives here. So health promotion during pregnancy, good nutrition, early prenatal care, exercise during pregnancy. So generally speaking, exercise is fine. If you've been exercising, you can generally keep doing what you're doing. Not if it's like really dangerous, but like, I don't know, something where you could hit your stomach and harm the fetus. But you should check with they should check with the doctor. And then things to avoid, so like horseback riding, water skiing, scuba diving, like you wouldn't want to play football, maybe flag football, but not tackle football, because those could be dangerous to you and as well as the baby. Oop, that needs to be week 4. Let me go back that way then. Just find all these things that I need to fix. I am so sorry. Good nutrition during pregnancy. Right, that's there. And then, so good nutrition. You do need extra calories, not a whole lot of extra calories, but yes, you do need extra calories. So they say 300, maybe 300, 500 extra calories to maintain a healthy pregnancy. Now, if the woman's already overweight, then the dietitian will work with you to find out how many calories you can have, because you still want to promote growth of the fetus, but you don't want to gain all this extra weight on top of what you already have. Tells you things to avoid. So like raw foods are not a good thing, smoked foods, unpasteurized milk, wash produce, wash your hands, right? Hand washing fights infection, cook things well. Folic acid is a supplement found in most of the found in the prenatal vitamins that the mother would be taking. So that helps to prevent neural tube defects like spina bifida. And so that's why nutrition is important. And then early prenatal medical care. So when you find out, the person finds out that they're pregnant, they should start to see the doctor, call the doctor, find a doctor to follow them through their pregnancy. And so there are specific schedules. Usually it's from the first week, or from when you find out that you're pregnant through the 28th week, you go once a month. And then from the 29th to the 36th week, every 2 weeks, and then every week thereafter until delivery. Could be a little different depending on the provider. OBGYNs, family practice, nurse practitioners, certified midwives can care for you. Most people, I think, would like to go to an OBGYN, but then it comes back to access to healthcare, right? What do you have available to you in your geographic area? Who's available? Do you have a midwife available? Midwives cost more. Doulas cost more. There's a cost for that. Going to the family practice physician at the clinic, that cost is much easier to bear. And so we check mom, we check baby, blood pressure, weight, make sure the baby's growing, check what's called the fundal height. So the uterus is a muscle. It is where the baby grows inside the uterus. And so the top of the uterus is called the fundus. And so we measure the height of the fundus on the woman's stomach, generally in regards to the landmark of the belly button, the umbilicus, we call it, umbilicus. And so we want, after about 20 weeks, 24 weeks, somewhere in there, we want the number of centimeters measured to be plus or minus 2 from the weeks that the baby is in gestation. So for example, if the mother by dates last missed period is at 30 weeks, we would want the fundus. They take a little tape measure, right, and measure from the bottom to the top of the fundus. I thought we had a picture. Yeah, there it is right there. They measure, and so we would want that top of the fundus to measure at 30 centimeters. We could be at 28, we could be at 32, but somewhere in there, and we know the baby's growing well. If it is too large, if it's much bigger than that, there could be growth problems that the baby's too big, like maybe undiagnosed diabetes, and so the baby's much larger. Excuse me, or it could be growth restriction or small for gestational age based on other factors. And try not to get too much into the medical side of it, just a basic understanding from a health care professional perspective of making sure that the mother is getting the prenatal visits, getting the care. We see women who have no or late prenatal care, and that can affect the growth and development of the baby and the health of the mother as well. So let's go back. Different discomforts during pregnancy, nausea, got to go to the bathroom all the time, headaches, backaches, sweating. There are also pregnancy complications, things that can happen during pregnancy that can affect mom as well as baby. So you have a little list here of things that can happen. An ectopic pregnancy, for example, is one where instead of the fertilized egg being implanted in the uterus, it implants in the fallopian tube. And so that can cause, if as the baby would grow, the fetus would grow, it can actually explode the fallopian tube, and you can get peritonitis, internal bleeding, and die. Not a good thing. Miscarriages, for some whatever reason, 10 to 20% of pregnancies end in a miscarriage. Many different reasons, and more than 80% of those happen in the first trimester. So sometimes you don't even know you were pregnant because you have maybe a really heavy period and you think, okay, well, that's just my period. You didn't really even know. Hyperemesis gravidarum is emesis, right? Emesis, throwing up, vomiting. Gravidarum, gravid means pregnant, so throwing up in pregnancy, but it's hyper throwing up. It's like you can't stop throwing up. It's just severe, persistent, and you're losing fluids, and so that's not safe for you. And then also there could be congenital disorders. Things that are seen later on in pregnancy, complications, preeclampsia. So preeclampsia is a fancy word for high blood pressure in pregnancy, which can lead to seizures, which can take away the oxygen from the baby and the mom, and there's problems there. Gestational diabetes. So you have type 1 diabetes that you're basically born with, and then you have type 2 diabetes like me, where you get that generally as an adult, although more children are getting type 2 diabetes, mostly for being overweight and an inability to process the insulin. And so gestational diabetes happens during pregnancy, and during pregnancy only. So if you are a type 1 diabetic who gets pregnant, you do not have gestational diabetes. You are a type 1 diabetic who is pregnant. But if you're type 2 diabetic, then you don't have gestational diabetes. You're a type 2 diabetic who's pregnant. But if you don't have diabetes has not been diagnosed, and you get diabetes when you're pregnant, then that is considered gestational diabetes, and it usually goes away after the baby is born. And there's different tests they can do to check for that. Preterm labor before 37 weeks of pregnancy, different infections that you can get, vaginal bleeding for various reasons. You can have where the placenta, so if you have the uterus and the baby's going to come out the vagina on the bottom, you can actually have where the placenta is covering that opening. So there's no way for the baby to get out to be born. So they would have to do a cesarean section, which is surgery. Placenta accreta or other different problems would be where the umbilical cord is not inserted into the placenta very well. It's kind of, they call it, or velamentous insertion is another way. And the baby gets their nutrients from the placenta. So if there's problems with the placenta, there could be growth problems with the baby. Depression, anxiety, different fluid levels of the amniotic fluid, too much or too little, can also give us clues as to things going on with the baby. And then anemia, if you don't have enough red blood cells, then you're not getting enough oxygen and the baby's not getting enough oxygen. And so those are some problems. And then anybody's at risk. But if you have already high blood pressure, diabetes, there are some women who have cancer that are pregnant. Kidney problems, epilepsy, things like that can be dangerous. Also, being older than 35, they call that advanced maternal age, AMA. With my third, I turned 35 the day he was born, but I was considered AMA the whole pregnancy. Younger than 20, smoking, drinking, twins, triplets. If you have a history of miscarriages, obesity, or anorexia, those things can all affect the growth and development of the baby. Those are some other things. Teen pregnancies. People do die from being pregnant. And then, and I have 2 articles about that. And then when to call the doctor. So those are some complications, pregnancy complications. Just so you know, I think for the most part, everybody says, "Oh, I'm pregnant, I'm gonna have a baby, it's great," and things go great. but then there are problems. And so racial disparity related to maternal deaths. So racial disparity found in US pregnancy deaths, and this one's from the CDC working together to reduce African American Black maternal mortality. So those are just more for your interest, but to understand that women do die based on their cultural background. So this is, oh, see, that one goes to week 4. That's the right link. So it talks about pregnancy-related death. Generally speaking, because these particular women are treated differently than other cultures, races of pregnant women. So it's really kind of sad. It's a bias on we talked about implicit bias and cultural considerations, right? That's where this piece comes in, and as well as the social determinants of health. So you can see why, hopefully you can see why we started with some of those concepts, so that as we now go through these stages, you'll see how it all ties together. And then talking about fetal viability. So when is the baby viable? When could it live outside of the uterus? Because the uterus is this nice little place, and there's oxygen and there's nutrients, and it's warm, and the baby's floating around and very safe. And but what if something happens? When would they be able to live not in that environment? And so this just talks about another article, how you would diagnose that, different causes, and basically they want, sorry, I was just looking through that. So there could be reasons why it would be a non-viable pregnancy. It could actually be something that's called a molar pregnancy, which is just a bunch of cells, not an actual fetus. There could be a genetic problem with the baby that maybe is not compatible with life. So trisomy 18, anencephaly, where part of the brain is missing. And so then the family might be given, that mother would be given the option to potentially terminate the pregnancy because of that. We use ultrasound. There's many different levels of ultrasound now that can really tell us what's going on, maybe with a heart defect or kidney defect. It's still the person's choice whether to carry the pregnancy to term. It's up to them. Because I do the OB clinicals in the nursing program, and we have seen some mothers who, we actually had one who didn't quite believe the doctors that there was in fact a problem with the baby, and so they wanted the baby to be born so they could see for themselves, which is their choice. And the baby lived for, I think, 3 hours. This was actually an anencephalic baby, so part of their brain was missing in the back. And but it was nice because they got to spend those 3 hours with the baby, so that they were very happy with that. Might seem a little odd to us as healthcare providers, but that was what they wanted, and the staff was there, the healthcare providers were there to help them through that. And so we're looking now at the fact that babies 20 weeks, 23 weeks, let's see. So rates of neonatal survival to discharge, so the time they get discharged, it goes from 23 to 27% for births at 23 weeks. So if the baby's born at 23 weeks, there is a 27% chance that that baby will be discharged home. So babies born at 24 weeks, there is a 59% chance that those babies will be discharged home. And then 25 weeks, there's a 76% chance that that baby will be discharged home. And it also states, this is from ACOG, which is the American College of Obstetricians and Gynecologists, that deliveries before 23 weeks, so 20, 21, 22 weeks, have a 5 to 6% survival rate. And that significant morbidity is universal among the rare survivals. So that means that they're very sick. There's a lot of developmental delays for those that do survive. Now, that's not to say that there's a 22-weeker out there that isn't living a fairly what we would consider to be normal life. But the question is, well, where is that cutoff? Do we just say, oh, well, if they're, we want them to be at least 25 weeks because there's a 76% chance, and the percentages are increasing, right? Because our technology is getting better, and hopefully our prenatal care and the things that we're seeing can help mothers go longer in their pregnancies. So just a couple ideas, things to keep in mind. And if you are if you are a 24 weeker and are the lungs develop, so they have to give certain medications to help with the lung maturity, lots of physical therapy, occupational therapy, speech therapy, a lot of really intense things that need to happen in those first years of life. And that's family systems theory. That affects the way the family interacts with each other, with the siblings, finances, right? Being able to access medical care for the child, support systems for the family. So that all plays into that aspect. And then you just have some videos for each of the some different stages in the pregnancy, just to show you the development. And then your journal questions there. So taking into consideration your community windshield survey, right, or the Salinas Valley, what do you think are the top 3 teratogens that pose a risk to pregnant women in that community? So that was one of the reasons we did the community surveys, windshield surveys, so you could go through and see what the community looks like. So now we take that information and neighborhood and built environment, social and community contacts, and are there teratogens? Is it an advantage, a disadvantage to live in our area or where you are? Students talked about Soledad and King City, not just Salinas. So I think that would be interesting. Some things are probably pretty would jump out at you right away, but there might be other things. And then what could you personally do to help reduce mortality rates for African American women during childbirth? What can you think of? And then how might growth and development of a baby born at 24 weeks compare to that of a baby born at 39 weeks, where 40 weeks is a term baby? So you can look through that growth and development. And I talk too much about that because I'm very passionate about prenatal and prenatal care. And let's go back to that module. Right, so we did the overview, we talked about genetics, we talked about prenatal development, we talked about the genetic influences paper, essay. Let's talk about the prenatal plan of care, since we just talked about prenatal care, prenatal stage of life. And so what does prenatal care mean? And so understanding the basic components, a simple and effective prenatal care plan, and to present it clearly and concisely, which I never do. I don't know why, but that's why you have to keep asking me questions. And so you want to do a literature review, read at least 3 reliable sources. You can, from the lessons that I've given you, I will go back and make sure those links work. And then, or reputable internet sources. You can also use, if you go over here to the Hartnell College Library, which is why it's there, if you click on that, it should take you, hopefully, yep, right to the library, research resources, library staff hours, summer hours. They have summer hours. If you need help with research, you can email or text or call the library. They can help you find resources, articles. You can also visit the website, but it's a great resource, and I don't think students use it enough, especially in an online class where you can't necessarily get to campus to go to the library. Then you just let the librarian know, this is kind of what I'm looking at. Where do you suggest I look? Or could you find me an article about this or that? And they're pretty helpful. And then you're going to create a plan. So you are going to have to be creative and create your own fictional client, right? And so you're a healthcare professional, right? This is where we're coming from. Basic details, age and general health. So you could make them an 18-year-old that's in pretty good health, but eats fast food all the time, or smokes, or does drugs. You could make them 40 years old, so they're advanced maternal age, and they have hypertension and diabetes. It's whatever you, whatever strikes you, whatever you'd like to create that character, that client. And then you're going to develop a plan for this person, which should include dietary recommendations, nutrients, foods to avoid, exercise recommendations, basic physical activities, taking into account if they already exercise or if they don't already exercise. They don't, if they're fairly sedentary, they don't do a lot of exercise, then we still want them maybe to walk or do some light exercise, but we're not going to have them out doing a marathon. Swimming is a good exercise, something like that. Emotional mental health support. So what can help? Is there any resources that can help support them emotionally? And then prenatal checkups. List the recommended frequency of prenatal visits and basic screenings or tests. So they're in the resources, in the lesson, all these questions. We went over these in the lesson, most of these just now. And so, and then are there any basic screenings or tests? Do they draw blood work? Do they do an ultrasound? So you're gonna have to look that up. And so then what you want to do is turn in a written summary. So 2 to 3 pages, maybe, detailing your care plan. You could do bullet points if you want. I am going to take out MLA or APA format because I'm not having that this summer. We're just going to do stuff and not worry about APA or MLA. And then prepare a presentation summarizing your prenatal care plan. So the paper is going to go into great detail. The presentation is going to be, it could be a PowerPoint. It could just be like a poster. One of the students did a really nice like flyer, like handout kind of thing for the genetic heredity assignment, which had all the components on it, and it was beautiful. So you don't have to reinvent the wheel. You don't have to make it, this great slideshow or whatever. You could just do a handout or what you would consider to be a poster, or a brochure, something like that. And then here is your rubric. So we're going to follow the rubric. The other thing about rubrics is to look where the majority of points are, because that's where you, that's where the majority of points are that you can earn. So some people in the, which was it? The community windshield lost points in the last category, which was tying in what you've seen in the community to growth and development, and that was worth 4 points. And so a lot of students only received, earned 1 point because they didn't tie it in. If there's not access to healthcare or education, how might that affect people's growth and development? So here we go. So research. So using at least 3 reliable sources. So you've got to have listed 3 reliable sources on, you can just make it a reference page, that's fine. And but you need to have them in the body of the paper, so I know where you got the information. So 3 reliable, reputable resources. And then the actual care plan itself, complete, accuracy, and is it appropriate? Are the recommendations accurate? So you're going to make your client, right? Is it appropriate? And then does the plan include nutrition, exercise, emotional mental health support, prenatal checkups, right? So it's basically, did you put all of this into the paper, right? And so, and it is easy to understand, it flows well. This is the written summary. So the formatting is, I've used correct grammar, capitalization, punctuation. Writings at a college level, communication, the key points is very clear. So it flows, it's got a logical order, it makes sense. And that should actually probably say formatting, not written summary, because this is really, your care plan is your written summary. And then the presentation, again, whatever you're using as your visual aid. So whatever you choose to do. You can make a video, like I said, handout, whatever you want to do. And effectiveness of the communication to explain the plan. So it would be what you would be giving to the client, right? The summary paper is what I'm looking at, what you would give to me. I mean, you're still giving me the presentation, but the presentation, I guess it should be more called information, but that is what you would give to the client. Okay. And should have all of those components from the care plan, right? It should be in there, and that's worth the most points. So have fun with that, right? Think about how you can make it kind of fun for the client. Okay, and then let's go back to week 4. Make sure we covered that. We've gone over that. Your week 3 journal, and people are already turning that in. That is due today. And so so here's the summary. So I took each piece, right? There's your questions to answer. And there's the quiz, which will open tomorrow at noon. Here are the focus areas. Excuse me. So nature versus nurture, and effects on growth and development of children, how genetic disorders are inherited. When we talk about the alleles, teratogens, we talked about teratogens there, and then prenatal care, different aspects of prenatal care, and then how to encourage newly pregnant women to seek out early prenatal care and continue throughout the pregnancy. So those are the areas to focus. And you have, again, the 2 hours, you have 2 attempts. I think everybody understands you have 2 attempts. So that's why I try to stay on top of the grading so that I can do the short answer questions and get everything back to you. You should be able to see which questions are answered incorrectly. I don't believe it gives you the answer, but it does tell you which ones you've missed and what else, right? Yeah, and so you'll see one score, say it's out of 10 points, right? So you might see 6 points initially, but there's 4 points worth of short answer questions. So I go in and I grade that. And then you get your 10 points. So you see the grade change a little bit, but please go back and do it again. But wait until I've graded the short answers. So what would be helpful is that when you're writing these short answers that you put them on a Word doc, because if you earn full credit for them, you want to use them again in the second attempt. So copy and paste from the Word doc into your quiz. I hope that makes sense. And then, so focus areas, the quiz, it should say it's not going to open. Yep, so it doesn't even give me that information. And what else? And then also for this week, we are halfway through week 4, right? This is an 8-week course of 16 weeks worth of material. And so this is anonymous, it's ungraded, it's locked till tomorrow at noon. But it is questions like, how do you think you're doing in the class? What are some things you could do as a student to be more successful? What are some things I could do to help facilitate your learning better and help you to be more successful? Like making sure the links work, those kind of things. And so it's just kind of a check-in to see how that's going. All right, let me stop sharing. And I think that covers it. I will be moving on to the week 5. I opened up week 5 yesterday, so that information is now open. And so that is going to center on the birth process, the postpartum period, and then moving into infancy. So the birth process is important. Things can happen during the birth. Things can happen to mom, the family, the baby. How is everybody affected by the birth? And then the postpartum period, sometimes there can be things that happen to the baby, the mom, the family during the postpartum period, which is after you've had the baby, and you're still trying to sort of adjust to being a parent and how to provide infant care. And then we'll actually start to move into infancy. And so we will be referencing your developmental theories, right? So Piaget, Erikson, Kohlberg, start there. Maybe some Vygotsky for language development. So make sure that you have sort of an easy, quick reference to get there. What else? I think that's it. So you know how to get a hold of me on chats. You know how to sign up for office hours. I might go ahead and do office hours, a Zoom office hours, and ask the groups to come so that I can make sure that the groups are all have a way to contact each other, just a little like a 5-minute check-in. So if I do that, I will post that in an announcement. So make sure that you have your announcements, the notifications set. And the Canvas student that you can do on your phone doesn't necessarily let you, I don't think, set those notifications. So make sure that you check with each other or go to Canvas Help or contact the IT department at Hartnell, and they can help you get those set so that you're getting the announcements. You know when things have been graded. You know when I've provided feedback. So on your assignment, I will either leave comments in the little comments box, or I will actually leave a comment on the document. Sometimes I've cut and pasted and left comments, specific comments on an essay or paper, trying to give you some good feedback. What else? Your week 3 discussions are due tonight by midnight. So please remember to do the initial discussion and then also respond to 2 peers. And that has to be at least 5 sentences. I've been kind of lenient because you are providing some feedback, which is great, but it really should be on point, on topic, and 5 sentences, something substantial. Technically, a discussion means that you post and then people respond to your post. You respond to other people and ask questions, and there's supposed to be this back and forth dialogue, but I have yet to get students to do that. So just do your best. Remember to try and get those in on time. Again, for weeks 3 and 4, there's no deduction for lateness because of the Wi-Fi issue down in South County. So if I've forgotten anything, I'll put out an announcement, and I hope you guys have a great 4th of July, and I will see you in the week 5 module walkthrough. Thank you. Have a great day.